Today, the Mayor and I are at a really important conference at Manchester Metropolitan University, talking about the Greater Manchester approach to tackling drugs misuse. We know that drugs cause huge misery to communities who suffer the effects of organised criminal behaviour and antisocial activity. We know too that people are exploited by those criminals, including children or people vulnerable to modern slavery. And we are determined that our strategy will protect those communities and individuals. We also know that people who are struggling with addiction need help, not coercion and punishment. And that's why we are also very pleased today to be working with public health colleagues, providers of drug and alcohol services and other frontline workers to talk about how we can properly design and deliver services that support people who are struggling with substance misuse. We're very privileged to have Dame Carol Black and Rachel from the Home Office to talk to us. We're also delighted to welcome Alison Crockett from Scotland to hear about what's going on there.
Drug dependency is a very complex condition. You need health interventions, but you also need to have safe housing. And Manchester has put a real emphasis on housing and making people feel safe. If you are not in a safe house, how can you go to work eventually? So it's bringing together all those things around a person that they need: housing, work, mental health, social care, Citizens Advice Bureau. You need them all.
Greater Manchester approach has been to bring together the Combating Drugs Partnership across all of the combined authority, and I think that's a great example of an area that is sort of bringing together a range of different partners to look across boundaries and understand how they tackle local challenges with long-term strategies. And we heard today the new strategy from the Greater Manchester Police, which allows them to tackle drug harms, allows them to work with the treatment services, recovery services, and think about prevention and long-term goals.
Most importantly today, we're going to be hearing from frontline practitioners about how we can improve services for people struggling with drugs misuse in Greater Manchester and give them and everyone a better future and more hope.